The materials I have here are the underpad, the urinary bag, the two-way Foley catheter, and my urinary set. And before we do the procedure, we will make sure or secure the urinary bag, and we are going to tape it on the side of the bed. And so now, after we tape, then now we can go to the next procedure. We can open the blanket and expose the area where we are going to do the procedure. And now, so now I'm going to expose the area where I am going to perform the procedure. Is it okay to ma'am? Okay, thank you. So now we are going to expose the area where we are going to put the underpad. So now ma'am, I'm going to expose the area. And then put on the underpad. Ma'am, can you lift your buttocks a bit higher so I can insert the underpad? Okay, thank you. And after we put on the drape for the patient, then we can use the hand sanitizer to sanitize our hands, because we are going to wear the clean gloves upon cleaning the area where we are going to do the procedure. And so now I have here in my tray the equipments that I'm going to use, and then the plastic, we can use this for the disposal of the stuff, dirty stuff. Then I'll put in, and then we can also put the equipments to the side where or to the place or to the side where it's easy for us to reach. And so the inside of my tray set, here I have the forceps, assuming this is a forceps, and I have here the eye sheet, and then my clean gloves, and then my sterile gloves, and then my cotton balls, and then my cleansing, and then my syringe, and then lubricant, and my specimen cup later if we want to collect for the fluid. And then my syringe, I put 10 cc of sterilized water later to be used to inflate the balloon of the Foley catheter. So now I'm going to wear my clean gloves and perform the cleaning procedure of the vagina before I'm going to insert the catheter. And upon asking the patient's information, we can take a look at her or her wristband to make sure that we are asking the right patient to perform the procedure. May I take a look your wristband, ma'am? And what is your name and your birthday? Okay, so today ma'am, I'm going to perform the urinary catheter to you. as per your doctor's order, because we understood that you have difficulty urinating. So later on during the procedure, you may feel uncomfortable and uneasy, but after the procedure, you will feel relief. And I will be going to insert that catheter through your urethra into your bladder so you can excrete your urine. Is it okay to you, ma'am? Is there any questions or clarifications before we start the procedure? Okay. And after talking to the patients, and she agreed that you're going to do the procedure to her, and then we provide privacy, close the curtain and door so that she will not feel embarrassed during the procedure. So we will close the curtain. And after we perform the closing of curtain and doing the procedure, we should also provide good lighting for good visualization upon doing the procedure. And then we should position our patient into dorsal recumbent position for good visualization as well, and for the good visualization of the meatus. And after we done the procedure, we can remove the eye sheet. Ma'am, I'm going to remove the eye sheet. Then throw inside the bag. And then after that, cover the patients. And ma'am, can you lift up your buttock? I'm going to take the underpad. Okay, thank you. And then after that, cover the patients to avoid chills and tensions, and for her comfortability as well. So now we are done the procedure. So how are you feeling now, ma'am? Do you feel relief now after the procedure? Okay. So after that, we can discard our gloves. Just do like this, and then after that, put one finger here, and then we can discard the gloves like this, and then we can throw inside the hands. And after we done the gloves, then we are going to perform hand hygiene, and before that we can discard the equipments, and then we can throw it inside the dustbin, and then after that we can perform hand hygiene, and then we are going to do the documentation. And during the documentation, don't forget to write down the date and time of the procedure and the size of the catheter used. And I use the two-way Foley catheter, latex silicone coated size 14 French, and also record the amount of fluid used to inflate. So I use 10 cc of sterile water to inflate the balloon, and of course don't forget to take the amount of fluid or the urine you get from the patient to put on into the specimen cup. And that's all. Thank you. And now I'm already wearing my sterile gloves, so we are going to put the eye sheet. And then after that, lubricate the Foley catheter 1 to 1.5 inches. Then after lubricating, then we can proceed to the next, and then we slowly insert it to the urethra where the urine passes through. We will insert it 2 to 2.5 inches until the urine flow. And slowly. And then after we insert, we make sure that the Foley catheter will not go back and forth, because this will cause of infection or the dilation of the fluid inside. And if we want to collect the specimen for the patients, we will pinch the catheter, and then we will put the specimen cap in place, and we must pinch the catheter because urine will flow out if the lumen is not occluded. And after that, we will connect the catheter into the urinary bag. And after connecting, we will inflate 10 cc of sterile water to inflate the balloon. And if we want to take off the catheter, we can deflate it. Inflating the balloon is important so that the catheter will not slip off and come out into the patient's sex organ. And after that, we will tape the catheter into the patient's thigh. And for the male, the place where we will tape the catheter is on the abdomen. And after that, we are done. And then we can collect the specimen now, and then we can keep it. And after that, after we do the procedure, we will